if your foundational subjects are good, because you could address at least 40% of questions from medicine from your knowledge of path and pharmac, right? And also some questions from medicine from your knowledge of physio. Many questions in surgery you can address from your knowledge of path and anatomy. So that's why the 60% weightage of your time available should be allocated to first and second prop subjects, and then remaining 40% time should be allocated to the third and fourth prop subjects. Okay, first point. Second point, when you're doing first prop subjects, concentrate on the MCQs, because examiners have a standard language. They keep asking the same kind of questions with a little bit of twisted language. So as long as you're practicing MCQs on these subjects, the anat, biochem, physio, path, pharmac, and you're getting 60% questions right, you can presume that you're on the right track. So you don't have to feel anxious. You're getting 60% right, you're perfectly on the right track. Now, what should I do for these other subjects? These other subjects, you need to take a individualized approach. For example, medicine is a very vast subject. But the truth is, when you look at the medicine, 60% of your questions will be coming from only 25% of your syllabus. And remaining 40% of the questions will be coming from 75% of the syllabus. So don't aim to complete everything in medicine so that I get 100%. Nobody generally gets 100% in medicine or surgery. So rather, what I would suggest is identify this 25% of the syllabus and concentrate on that. If you have time, you have already done medicine and you have completed 100%, good. If not, I can help you to strategize to pick those 25% topics. And that way, all of our other teachers, like if you want the list of important topics from surgery, Dr. Sandeep should be able to share. Prasant sir should be able to share the important topics from OBG, right? So I will definitely give you the list of important topics that I want you to do before you step into the examination hall. By doing that 25% of the syllabus, you will be able to hit 60% of your medicine question. And remember, if you have already done this, that number will go to 70-80%, which is a great number, which is, to be very frank, great number, because that will definitely, if you're getting that number, you will be able to cross total 200 out of 300. Okay. Then second, again here, when you look at all the subjects, I want you to basket some subjects which are not very much conceptual and rather fact-based. Not much of concepts are involved, they are fact-based. We will keep them aside. What to do for that, I will tell you. So first key point, 60% on first and second prof, 40% time on third and fourth prof. Don't think that, sir, the subjects are clearly divided, so I will give 50% this side and 50% for the second paper. Don't think so, because you may have a lot of questions coming from these subjects in your second paper also. Okay. Then second thing, once you've done this one round of reading, please have an individual strategy. These are the subjects where I want you to do detailed study, means whatever is your main source, complete that for the first and second prof subjects. And in the third and fourth prop subjects, I want you to selectively pick up the subjects which I want you to do completely detailed. Whatever is your source, do the videos, do the Q bank, do the notes. And I also want you to stick to rapid revision, notes and Q bank for the selected subjects. So what subjects I want you to stick to rapid revision rather than going for the main source? Medicine, I want you to go through rapid revision. This is kind of more than enough if you are able to cover the 25% of the key topics that you need to do. Surgery, I want you to go through rapid revision. Okay. And then for all these minor subjects, I want you to stick to rapid revision. You don't need to do a detailed study of these subjects to get 60 to 65% of marks comfortably. If your aim is to get 80-85%, of course, then you need to do the main videos. And for the third prof, you all know that ENT, Ophthal, PSM, FMT, they are all high yield and they can be completed in a very short span of time. So I would recommend you to do main videos for ENT, Ophthal, PSM, whatever is your main source, whatever source you have been currently reading, stick to them. But other subjects, choose wisely and spend wise amount of time. Don't spend random amount of time. Okay. Now that we have done first round of reading, by carefully choosing the first prop subjects and second prop subjects, we are doing a detailed study. Third prop, I'm recommending you to do the detailed coverage. And for the final prop, most of the subjects I'm recommending you to stick to the rapid revision. Ops Gyne, depending on your level of current understanding, you can choose the main source or the rapid revision or any concise source. Once you've done this first round of reading, I want you to go through 3 rounds of revision, and this is the most important thing. 3 rounds of revision. So what I want you to do in the first round of revision? In the first round of revision, what I want you to do is quick recap of your notes, whatever notes you are following now for the first round of reading. Like we have completed a 1 round of reading. For some subjects we have done, let's say, main course. For some subject we have done the rapid revision or some concise content. Whatever it is, recap the notes in the first round of revision. Follow that up with a grand test. This will give you a little idea and you will be able to identify that what are you lacking. Oh, I'm not getting the diagnosis right in the question. Once I get to know that this question is talking about, let us say, cardiac tamponade, rest of the points I knew, but I did not recognize that this question was talking about the cardiac tamponade. So then you learn that you are lacking in identifying diseases. So one lacuna you identified, or you are capable of identifying the diseases, but you don't remember the facts about the disease. So first test will help you to identify the lacunae, and you should use that information for your next round of revision. Use that information for your second round of revision. How to use that information, I'll tell you. Let us say in the first GT, you notice that in medicine, you're not getting the diagnosis. So in the second round of revision, when you're going through your notes, I wanted to concentrate on the buzzwords because most of the diagnosis happens because of buzzwords. For example, if I talk about, let us say, hypotension, in a patient, he is having hypotension plus raised JVP plus muffled heart sound. What diagnosis comes to your mind? Of course, you know this is talking about Beck's triad and cardiac tamponade by default comes to your mind. So I can say that these are buzzwords, or Beck's triad is a buzzword for cardiac tamponade. You open any book, any MCQ, any PYQ about cardiac tamponade, invariably it is talking about these. Similarly, if there is a question about, let us say, constrictive pericarditis, usually they mention buzzwords like pericardial knock, or they mention another buzzword that is steep wide descent on JVP. So once I notice these buzzwords, this question is talking about constrictive pericarditis. If these buzzwords are there, the question is talking about cardiac tamponade. So for every disease, you can make a short list of 4 or 5 buzzwords. The moment you see those buzzwords, you know that this question is talking about that particular disease. So that solved your lacunae that you had identified in first GT. So at the end of first GT that you give, after the one GT you give after the first round of recap of the notes, I want you to implement what is needed to be done in the second round of revision, right? So in the second round of revision, fill your lacunae and revise. Fill lacunae and revise. You will identify multiple such lacunae in your preparation. For example, instead of struggling with diagnosis, you may notice that I diagnose easily, but then I forget about murmurs. That means you need to have a table of murmurs to revise. If I forget about the different channels in the nephron, then I need a table of different sodium, potassium channels, their locations and their functions in the nephron. So identify those lacunae. As you go through the second round of revision, fill those lacunae so that that issue is sorted. And then I want you to go through another grand test. By this time, you start getting an idea that whether you are heading in the right track or you're still having lacunae. And after the second GT, I want you to give the third round of revision. Please make sure that the time spent on each round of revision goes shrinking. How do I keep shrinking it? You can keep eliminating the topics which you feel that I'm comfortably able to remember. Because, like, for example, cardiac tamponade, you can summarize in key points. Okay, if I think about cardiac tamponade, patient will present with Beck's triad. Most common cause is blood in the pericardium, that is hemopericardium, usually happens because of trauma. On the examination, JVP will show raised JVP and absent wide descent. Auscultation, there will be muffled heart sound, and emergency treatment is needle pericardiocentesis, definitive treatment is explorative thoracotomy. These are the key points. Okay, if I'm able to remember this, I do not have to include that in the next round of revision, so that the amount of information I need to revise goes shrinking. And as you keep revising, keep building what I call as memory maps. Memory maps. So these memory maps will help you to reduce the time that you need to give in the second round of revision. I will demonstrate you with an example also what you can do. So let us say I have read once, whatever memory I start revising now. So as I start revising, let us say I get into the cardiology and I start revising valvular heart diseases. Okay. So now, how can I make sure that this revision is effective and I should be able to remember stuff when I come back for the second revision, right? So you can create a simple sketch of any organ that you are studying. Let us say now we are talking about valvular heart diseases, and one of the valvular heart diseases I'm going to study is aortic valve, and then eventually mitral, tricuspid, pulmonic valve. So you can label like this. Okay, this is aortic valve, and each valve will have two conditions. So one of them is going to be aortic stenosis, the other one is going to be aortic regurgitation. So during revision only, in this page, you can start adding the key points that you may forget. It may seem like, okay, I'm going to take time. No, you're not going to take time, because you're not going to write sentences here. You're only writing the key points. So what important points I want you to remember for aortic stenosis? I want you to remember that the most common cause is age-related degeneration. I don't have to do an elaborate sentence. I am just writing age. Okay. Symptoms wise, these patients present with ASD, angina syncope dyspnea. This is a mnemonic you would have remembered from your main notes. On examination, you are getting a murmur, which is going to be ejection systolic crescendo decrescendo murmur. If you want, you can put a picture that there will be a click and then an ejection systolic crescendo decrescendo murmur. And in terms of treatment, these patients are treated with aortic valve replacement. 4 or 5 points. Now on top of that, if there is any important factual information like what are the indications for valve replacement, अगर लगता है कि हाँ इसके ऊपर बार बार questions आए हैं, so then you can put that on table at the bottom, right? Or if you feel like the markers of clinical severity, 2-3 points you can put. AS is summarized here within 6 or 7 sentences. AS is summarized. Similarly, we can do about AR also, right? AR, we can talk about the common causes. The most common cause right now is hypertension because of the aortic root dilatation. Symptoms wise, these patients present with visible pulses. They present with visible pulses. There will be increased pulse pressure, and they can have dyspnea as a symptom or shortness of breath. And on examination, we are getting an early diastolic murmur. Again, treatment we can consider using diuretics, nitrates, and aortic valve replacement. In the first reading, you're trying to understand all the concepts behind these points, but once you come to the first round of revision, you already have bit of concepts, so you can summarize the key points. When I did that, how much time I took? I took barely 3-4 minutes. Now when you read this second time in the second round of revision, it will take 30 seconds on this, 30 seconds on this. In the third round of revision, your brain already knows what are the key points you're likely to forget, or what are the key points that your examiners are interested. So you may be knowing that examiners are interested in asking you to diagnose based on murmurs. So your brain takes your eyes directly there. So the third round of revision will be much more quicker, right? A similar picture can also be created, let us say, for pericardial diseases. Valvular heart diseases, similarly, I can label here for mitral valve and mention key points for mitral stenosis, mitral regurgitation. So in one page, I will have a quick summary of all valvular heart diseases, 20 to 30 points. Most of the MCQs are going to come from those 20 to 30 points. Similarly, I can have pericardial diseases, right? And when we talk about pericardial diseases, we know that there are 3 pericardial diseases. One is cardiac tamponade, constrictive pericarditis, and acute pericarditis. For all these 3 diseases, there are only 3 or 4 points you need to know. Like for example, acute pericarditis, the key points that you need to know is in acute pericarditis, there will be ST elevation, which is concave, and a PR segment depression. Most common cause is idiopathic, and these patients are treated with NSAIDs or colchicine. When it comes to constrictive pericarditis, the buzzword is presence of a sound called as pericardial knock, and on the JVP there is steep wide descent. I can mention few important other points, like on right heart catheterization we get a square root sign. Cardiac tamponade, you know, there is Beck's triad, there is an ECG triad. So now already in 4-5 minutes we have discussed the key points about so many cardiovascular diseases. So when you do revision, if you smartly filter down in a visually aligned form, you will save a lot of time when you go to the second round of revision. And if you already have this memory map, then going down to the third round of revision becomes easy. Now in the third round of revision, I want you to concentrate mainly on volatile high yield topics. Volatile high yield topics. So what are these? There is no concept involved. It's all factual, but they keep asking again and again, repeatedly, very high yield. Such topics are the ones that I want you to concentrate in the third round of revision. That will happen just few days before your examination. So what are such topics? I can give you such topics from medicine. For example, in medicine, one topic is ABG. Right? So in the ABG is conceptual, but then calculation of compensation, there is a table of formulas, right? So the compensation formulas, that there is no concept, you just have to by heart them. So that you will keep it towards the end of your preparation cycle, so that nobody can remember all those mathematical formulas for months together. So take that memory, take that burden on the brain close to the exam, so that you can take it into the examination hall and dump it after the examination hall, right? ABG formulas. Then there are some named signs of AR, named AR signs, that they're all named, so we have to have some mnemonic or a rata maro for those, right? Then ECG diagnosis of AV blocks, some key points. So these are like things which are high yield. They keep asking questions on them, but at the same time, there is no concept. There is mostly memory based. So such things should be kept for a third round of revision. Other topics, if you're not including in the third round of revision with the lack of time, it's absolutely fine, right? So this is how I want you to go with your preparation. And after the third round of revision is done, avoid giving any GTs, stay fresh, and then get into the examination hall. And before you get into the revision mode, like during the revision time, I want you to give two GTs, but before that, when you're doing the main subjects, main first round of reading, give as many GTs, subject-wise tests, custom modules as you can do. Because the more you solve, you will understand the language of the examiner better, and you will be able to deal with MCQs in a more efficient way, right? So this is my suggestion. Let me summarize the suggestions that I have given you. Right now, most of you, I know you're still not completed your all 19 subjects, but take a moment, sit and think, at the current rate that I'm progressing, will I be able to complete all the subjects from the source that I'm preparing? If you feel you can't complete, then re-strategize, right? What is the re-strategy you can follow? Switch some subjects to a concise source or rapid revision, and keep some subjects with the main source. It's a personal suggestion that I want you to study first and second prof with little more detail, because the questions are factual. You can hit more right answers, less chances of going wrong when you know the facts, and then 40% of the time on the other subjects. But if you feel that you're strong here, then you can allocate more time to the third prop or fourth prop subjects. But please re-strategize. Think, will I be able to complete all the 19 subjects? You may be thinking that, sir, I will skip 3-4 subjects and give the exam. I will still, hopefully I should be able to get 150. But the truth is, NBE doesn't stick to their own blueprint. And there should be no surprise if medicine only gets 5-6 questions and OBG gets 50, 60 or 70. There should be no surprise at all. And in that case, if you're not done OBG but you are a master of medicine, you are a big loser, right? So please don't skip any subjects, cover all the subjects, but make sure you plan well, in the sense, do from a source which you are now able to complete. You might be doing from any other source. Let us say I have completed 50% of medicine, but I don't think I have sufficient time to complete the remaining 50%. For the remaining 50%, choose a concise source, right? It could be rapid revision notes or rapid revision videos. Choose a concise source for the remaining 50% so that you can finish it in a quick span of time. Once you have completed your first round of reading, get on to the 3 rounds of revision. In the first round of revision, scan through all your notes. And as you are scanning through your notes, if you feel like, okay, I am struggling to remember this, spend a little extra time on that particular table or flowchart. Try to remember. Give a wholehearted attempt at the first round of revision. And after that, give a GT. GT will help you to identify where you're missing or where you're going wrong. According to that, plan your second round of revision. During the second round of revision, make a conscious attempt to fill the lacunae. If you feel you don't remember the murmur table, if you feel you don't remember the PIH management, in the second round of revision, give extra focus on those topics and then go forward. Give another GT after the second round of revision. And a strong suggestion is that build memory maps in the first round of revision, which can make your second and third round of revision faster. Third round of revision should primarily focus on volatile but high yield, not volatile low yield topics. For example, some rare Garbosa's criteria or Brugada syndrome on ECG. It's volatile and it's not at all high yield. On the other hand, AV blocks, arrhythmias, and MI, STEMI. These are high yield topics on the ECG, right? Among them, you know that arrhythmias and AV blocks, especially AFib, PSVT, first degree and second degree Mobitz type 1, Mobitz type 2, these are repeatedly asked ECG questions. So concentrate on that. It will take only 20 minutes for your first round of revision, 10 minutes for your second round, and 5 minutes for your third round of revision. You run behind all these Garbosa's criteria, then the LBBB, RBBB, axis determination, barely questions have been asked. So it is like waste of time. So don't take any of them which are low yield into your third round of revision. If you have time and you want to do those topics also, finish it off before, but the third round of revision should be on extremely important volatile high yield topics. So now coming to my suggestions of high yield topics from medicine, request other teachers also to provide you a list of such high yield topics that I want you to cover, from which more than 25% of your, like more than 50-60% of your questions may come. In fact, right, so when it comes to CVS, I just want you to know the table of murmurs. Second thing is JVP, from which repeatedly questions are asked. JVP, I want you to do detailed. Okay. Then in the recent times, pulmonary hypertension has become a high yield topic in CVS. And then cardiac tamponade versus constrictive pericarditis had been a repeatedly asked high yield topic in the recent times. Between the JVP and constrictive pericarditis versus cardiac tamponade, every exam in last 3 years there is a question. Okay. And then when it comes to ECG, there will be question on arrhythmias. So you should know to diagnose and know the drug of choice for arrhythmias. Second, AV blocks, first degree, especially you should be able to differentiate between Mobitz type 1 and Mobitz type 2 second degree, and then determining the different types of STEMI on ECG. Right? These are the most important high yield from CVS. Similarly, when it comes to CNS, the most important high yield topics are myasthenia gravis, GB syndrome. In the recent times, especially the stroke, and when I say stroke, it is the stroke management, the protocol, when to do thrombolysis, when to go for mechanical thrombectomy. Then TIA, and when I talk about TIA, it's about the ABCD2 score. I forgot to mention, when we are talking about arrhythmias, you should also know CHA2 DS2 VASC score. DS2 VASC score. Okay. Then here emerging topic is multiple sclerosis versus neuromyelitis optica. Again, within the myasthenia gravis, most importantly, single fiber electromyography interpretation. So these are like kind of high yield topics from the CNS. I can also give you high yield topics for the rheumat. So when it comes to rheumat, I think you all know that SLE wise, mostly the questions are asked about antibodies and their correlation. Which condition is associated or which complication is associated with which antibodies. Then when it comes to scleroderma, you can expect image based questions about scleroderma and its complications. And then in scleroderma, the limited cutaneous versus diffuse cutaneous versus diffuse cutaneous. Another important topic from SLE is going to be lupus nephritis management. Lupus nephritis management. Okay. Then mixed connective tissue disorder. Mostly they will ask you recognize whether this question is about mixed connective tissue disorder or not. Mainly looking at the antibody and T1 RNP antibody correlation. Okay. Then when it comes to the rheumatoid arthritis, the questions are most likely going to come about the pharmac medicine integrated, that is anti-TNF alpha drugs and their side effects. So these are key topics from rheumatology. Then when you talk about nephrology, so the first set of questions in nephro will be AKI versus acute tubular necrosis. Mainly here the question may be centered around the fractional excretion of sodium. The second important topic is going to be different types of urinary casts and sediments. Then nephrotic syndrome, particularly what glomerular disorders present with nephrotic syndrome and what glomerular disorders present with nephritic syndrome. And all of those syndromes will have their own buzzwords. So you should be able to recognize those buzzwords. And another topic that I can anticipate is interstitial nephritis, hemodialysis and complications, and CKD related complications. So these are like extremely high yield. And as I list these topics, you may be able to cover these topics for revision in less than 30 to 40 minutes because there are just few key points. Different cast and sediments, if you have done that in the first round and you have spent time to remember them, in the first round of revision, this should take 10 minutes max. Second round of revision, 3-4 minutes. Third round of revision, just glancing quickly. Right? So these are nephro important topics. Okay. Similarly, for the gastro, most of your gastro questions are going to come from the surgery, and I would presume that most of you are doing it from surgery than from medicine, be it pancreatitis, be it ulcerative colitis versus Crohn's disease, all of that. From medicine, particularly what I want you to spend time doing is MAS-LD, which is a new term for the non-alcoholic fatty liver disease. That's an emerging topic in the recent times. Okay. Apart from that, liver transplantation. Indications, contraindications. Rest, whatever is covered in surgery is more than enough. So when you look at these key topics are doable, right? CVS, CNS, I missed RS. Let me write down the RS as well. So in the respiratory system, the important topic is interpretation of PFT to decide whether it is obstructive or restrictive disorders, and also flow volume loops. Second, the set of questions are going to come from asthma management, then brittle asthma and acute severe asthma. Brittle asthma and acute severe asthma. Like they may ask you, how do you diagnose acute severe asthma? I'm just telling you right now the buzzword for acute severe asthma. If question is talking about acute severe asthma, most often examiner mentions that patient can't complete a sentence in single breath. this is a buzzword. So you have to learn these buzzwords because, okay, the moment I notice this sentence in a patient of asthma, right, in the question, this sentence appears. I already know that the examiner is talking about acute severe asthma. And then he may be asking what is the first line of management and what is the drug of choice, right? First line is again short acting beta agonist nebulization and IV hydrocortisone steroid. But the drug of choice would be magnesium sulfate. So this you should be able to recognize. Then the third important questions in the recent times is about interstitial lung diseases. There it's mostly about the idiopathic pulmonary fibrosis versus non-specific interstitial pneumonia and occupational lung disorders. And when it comes to COPD, it's mainly chronic bronchitis versus emphysema. What are the differences? Where you get cyanosis, where you get the pursed lip breathing. Those are the kind of questions. You can easily make a short list of extremely high yield topics, which will condense the revision time to 1 or 2 hours. And as you go through second, third, you will be able to revise them in much lesser span of time, right? So strategize according to this or in any other convenient way for you, but make sure you have done 3 rounds of revision. And I am very sure you can't, no one can give the same amount of time for each round of revision or as much as I gave it in the first round of reading. So keep that in mind. As you go down through subsequent rounds of revision, you should progressively condense your content so that you are spending less time on the revision, right? So let me take your doubts. Ayush Banerjee, definitely we will be planning. Sure, sure. Okay, so if you guys have any.
Good evening, sir.
Good evening, good evening. Yeah, yeah, tell me.
I have some questions.
Sure.
First of all, thanks for the session.
Thank you. Yeah, tell me.
So how to make physiology easy? As if we are going through PYQs, either it be FMG or NEET VG.
Hmm.
Physiology questions are always on top level, so that thing makes the paper every time tough. And
Yep.
so second question, sir, how is it possible for the repeaters, as I am repeater,
Hmm.
I have not completed my first reading, still my 4 5 subjects are left.
Hmm.
And sir, in regard also medicine,
Hmm.
the topics you have done, are they enough for medicine? Will we be able to release
Huh.
do questions in medicine?
Okay, so let me
Thanks,
first
sir.
start with physio. Well, I personally know this that physio is probably one of the toughest MBBS subjects because there are a lot of facts. There are concepts, but along with concepts, there are facts, figures, and numbers, and that's why I have told you to allocate more time. Once you become sound here, rest things become by default easier. Right now that you have less time, the only wise and logical suggestion is figure out what are the important topics in physiology from which repeatedly questions are coming, right? Spend time on that. We have to, like, there is no way, none of us have more than 24 hours a day, so we have to spend our time wisely. So figure out the important topics, just like how I mentioned the important topics from medicine. Either you figure out by going through PYQs or PYTs or talk to a physiology teacher and gather the important topics and concentrate on that. So it's not the time to say that I will complete everything. It may not be possible. We have to be practical from now onwards. If you had asked me 3 months ago, I would have said now spend 1.5 months if it takes behind physiology alone. It's worth it. But I can't say the same thing now because we don't have that much time, right? Because you have to revise other subjects. Otherwise, you will become a master of physio, but everything else will go. So best thing is choose the important topics and just concentrate on that. Like as far as I remember, the PFT interpretation and the flow volume loops, then the cardiac cycle, these are all common, high yield, extremely important topics. So spend more time on them. And then the neuromuscular junction physiology, the muscle physiology, they are important topics. So spend your time there. Okay. Second, medicine. Yes, the topics I have listed are likely to give you 50 to 60% of the questions, though it's only 25% of the syllabus. Majority of the questions are looping around on these topics itself. So you should be able to get 50 to 60% of the questions right. If you've got a little bit of better understanding of physio, biochem, pharm, path, you may be able to push that number higher, even if you don't cover remaining 75%. There also, mastery is important in terms of pattern recognition. What is the pattern recognition I'm talking about? For example, we just made a list of nephrotic syndrome and nephritic syndrome as topics. But until and unless you get to know that examiner here is talking about nephrotic or nephritic, you will not be able to go forward in the question, right? So how will I recognize? If it is nephritic syndrome, right, the question will be mentioning that patient presented with hypertension and generally periorbital edema. If it is nephrotic syndrome, the question will be mentioning the generalized edema or anasarca. Then there will be proteinuria mentioned in the question, but less than 3.5 grams per day or per 24 hours, right? But if it is nephrotic syndrome, the patient will have hypertension, but there will be generalized edema or what you call as anasarca, and the protein loss or proteinuria will be more than 3.5 grams per day. Apart from that, in the nephritic syndrome, you will have additional clues. What are the additional clues you are going to get in the nephritic syndrome? The question will mention presence of dysmorphic RBCs, because here there is injury to the glomeruli, right? Most of the nephritic syndrome patients are glomerulonephritis. There is injury to the glomeruli, so they will have dysmorphic RBCs. They will have RBC CAS. On the other hand, nephrotic syndrome patients will have high amount of hyaline and fatty CAS. Here you are having RBC CAS. So the moment I see that there is a question which is talking about low-grade proteinuria, dysmorphic RBCs, RBC CAS, it is talking about nephritic syndrome. And if I had a list of which disorders present as nephritic syndrome, like the post-streptococcal glomerulonephritis presents as nephritic syndrome, then IgA nephropathy presents as nephritic syndrome, right? On the other hand, your minimal change disease presents as nephrotic syndrome. Focal segmental glomerulosclerosis presents as nephritic syndrome. Then nephrotic syndrome. Membranous nephropathy presents as nephrotic syndrome. So if I start recognizing these patterns, right, from the options, already many differential diagnoses are ruled out. And then again, for all these diseases, there will be 2-3 buzzwords. Those buzzwords are more than enough for you to reach the diagnosis in any question. But until and unless you are smart enough to follow this preparation, you may not be able to get good score. Like for example, if the question is talking about someone presenting with dysmorphic RBCs and RBC cast, you already know that it is nephritic syndrome case, glomerular injury, and then they mention that there was a sore throat before the incidence. Then it could be PSGN or IgA nephropathy. In PSGN, usually the symptoms appear after 1 week of sore throat, and in IgA nephropathy, almost within 2-3 days, definitely within 1 week. So now, if I know this much, I will be able to reach the diagnosis. Right? Similarly, membranous nephropathy, there will be anti-phospholipase A2 receptor antibody. That's the buzzword. So you should have a list of buzzword for the individual diseases, right? So that way you should be able to cover a decent 50-60% plus questions from medicine with the short list we have made today. You can apply that for many other subjects and you should be able to go past 50% even if you've just done the high yield topics and the PYQs. But yeah, physio, just make a list of important topics and then concentrate on them if you don't have time to complete it fully.
Thank you, sir.
Okay, next one.
Hello, sir. Thank you for the elaborated and nice idea for the December session. And my worry is I'm making a lot of wrong in hematology.
Okay.
How should I go about it? Even in medicine, we have hematology, in pathology,
Yeah.
also we have hematology. So how to and also I'm making a lot of mistakes in the CML, CLL, AML, and ALL. So it's quite disturbing me.
Okay, I understand. I think Dr. Ranjit should be live in next few days time to talk about a strategy for pathology as well. And he will be the better person to guide you because I don't peep into the microscope. But I can give you a rough idea how you can approach to hemat as well. So again, same thing, it's all about buzzwords. So you should be able to recognize the buzzwords. So I would always say that buzzwords is something that you should have a list of. Okay. I will not get into the onco part. I will leave it to Dr. Ranjit because most of the buzzwords are microscopic observations rather than macroscopic observations. But I'll just give you a brief idea how again you can apply it to hematology. Right? Let us say we're talking about bleeding disorders. Right? I'm just giving you an example. Let us say we're talking about bleeding disorders. There's a question which says that individual presents with recurrent bleeding. What all possible causes are there? Normally, when there is an endothelial injury, let us say there is an endothelial injury, the first thing we do is we form a plug of platelets, right? That is platelet plug formation. First, some platelets come and bind, it is platelet adhesion, then some more come and bind, that is platelet aggregation. And after that, we create a mesh of fibrin on top of that, and this formation of fibrin, we will call it as coagulation, right? Coagulation cascade. After that, we dissolve this fibrin once the healing is done. That is called as fibrinolysis. So the clot forming process runs in these three steps. So now if the question says the patient is having excessive bleeding, either platelet plug is not getting formed or coagulation cascade is not acting and I'm not making the fibrin plug. One of those, there is a problem, right? So these will be called as primarily bleeding disorders and these are clotting disorders. So whenever there's a question talking about increased bleeding tendency, it could be a bleeding disorder or this is clotting disorder, and if platelet plug is not formed, those will be called as bleeding disorders. Bleeding disorders, and these will be called as clotting disorders. How do I differentiate? If a platelet plug, these are primarily platelet defects. These are coagulation cascade defect where some factor is deficient or something is there which is impairing the factor synthesis like warfarin. So these platelet disorders generally present with superficial bleeds. The bleeding is superficial. Patient present with petechiae, right? When we say superficial, like petechiae. And these patients with coagulation disorders, they present with deep-seated bleeding in the sense like inside the joints, what you call as hemarthrosis. So if the question is talking about deep-seated bleeding, then it is a coagulation cascade disorder, right? Like some factor 8, factor 9, factor 11 deficiencies. But if the question is talking about petechiae, superficial bleeding, it is talking about platelet defect, thrombocytopenia, von Willebrand disease. Those are the conditions, right? Again, here the bleeding in the bleeding disorders or platelet defects, the bleeding is immediate after the injury. But here the bleeding is delayed because here platelet gets formed, gets formed. So initial bleeding is stopped, but later fibrin doesn't get formed. So there will be delayed bleeding. These conditions will be associated with increased bleeding time. These conditions will be associated with increased clotting time. Within this clotting disorders, intrinsic pathway and extrinsic pathway is there. They also can be assessed by looking at PT and APTT. So this gives you an approach to identify whether this question is a clotting disorder or a bleeding disorder. Similarly, you can also apply it to the anemias, whether it is hypoproliferative or hyperproliferative by looking at the proliferation index. Similarly, for the hematological malignancies, you can always create a pathway which segregates. Like one of the key clue will be the age of presentation, what is the predominant cell, and the buzzwords like BCR, ABL. All these buzzwords will always be there to help you reach the diagnosis. So don't take it like, don't think that I will be understanding everything about the disease and then I will make the diagnosis. Instead, build a pathway of buzzwords that take you to the diagnosis. Like I gave you this example, right? We also take few examples about buzzwords like acute pericarditis, Bextriad for cardiac tamponade. You will always find buzzwords for all the diseases, and that as long as you recognize them in the question, rest of the things are easy. Anyway, I will definitely put a word to Dr. Ranjit to like help you simplify the hematological malignancies as well.
Sir, thank you very much.
Okay, so anybody else with any other queries? From the YouTube? Okay, so guys, if there are no more queries, I'll be signing off. I'm definitely rooting for you. I'm praying for you. And I've just completed a round of offline and online classes. I've interacted, and I know that the current set of students are way better than the set of students we had few years back. So I'm definitely expecting a very high pass percentage this time. But make sure you don't give up right now, even if you're feeling mentally quite miserable or messed up. Talk to friends, family members, or take counseling, but keep studying. Consistency from now onwards matters a lot more than what you have done so far. You may be consistent till now, and if you don't consistently continue your preparation, you will flunk. On the other hand, you might have messed up so far, but from today onwards, you prepare consistently, you still have a brighter chances than someone who messes up now but was consistent till now. Maybe last 6 months he was consistent, but he messes up in the remaining months. You will do better than him if you continue to be consistent, or you be consistent from today onwards. So stay focused, keep studying. You don't have to stick to the plan I said, but the plan I said is what has worked for most of the students. So if you have to take a recourse or reconsider your current strategy, keep these points in mind. And any individual topic doubts, or if you find any topic which is very difficult from medicine, let me know. Like ABG you want me to cover, or the ECGs you want me to cover, I will definitely come live again on Telegram, and we will quickly brush through that. And trust me, we can simplify the process. There is always an approach, easy way. We can do that, right? And hematological malignancy is on me. I will definitely pass it on to Dr. Ranjit, and he will simplify it for you guys. Okay, signing off today. I'll see you in another Telegram session. Till then, study well. Let's stay committed. This is ये हमारा संकल्प है. We are gonna crack it this time. See you guys. Bye bye. Good night. See you. Bye.